A little over 5 years ago, I found myself being rushed to the emergency room. I was 24 weeks pregnant and in labor. We were utterly unprepared for this drastic turn of events. Nurses rushed to figure out what was happening and what to do about it, the flurry of activity only adding to my unease. Within minutes of my admittance, a neonatologist arrived to discuss what was happening with the baby. His words were abrupt and stark and did not prepare me for a devastating loss. Just about everybody in this country has had the experience of working with a medical team in unfavorable circumstances, whether for themselves or for a loved one. Medical offices and hospitals become the sites where some of our most memorable and life-changing moments occur. Healthcare providers are often a part of or witness to people at their most vulnerable. It is that vulnerability that makes good communication skills a critical tool for all healthcare providers. It is time to make oral communication training a part of the coursework for those training to become healthcare professionals, as well as a part of the job training and workplace protocol for all healthcare settings. Doing so is necessary for 3 reasons. First, because this is not yet standard practice. Second, improved communication between healthcare providers and their patients leads to improved patient adherence to medical instructions. And third, communication training provides medical professionals more effective and positive tools for navigating difficult conversations with vulnerable people. While effective communication skills are an essential aspect of patient care, training in oral communication is often overlooked in programs that prepare healthcare providers for practicing medicine. Only about 1/3 of nursing programs in the United States require any oral communication coursework. Britain has been working toward incorporating communication training in their doctoral programs, as detailed in the article Communication Skills Training in Postgraduate Medicine. However, no such program has been initiated here in the United States. Furthermore, while a program for those going through doctoral coursework is a good start, most patients interact with professionals who have training that ranges from technical degrees up to postgraduate work. Reserving communication training for only those who are completing doctoral programs fails to provide training for a vast number of healthcare providers who work with patients. A core but often overlooked component of providing healthcare services is the need to provide patients with healthcare-related literacy as well as treatment plans. In a study titled Addressing the Social Needs of Hypertensive Patients, Antoinette Schollenthaler and her team recorded the conversations that occurred between patients and their doctors. When tracked how well patients took the prescribed medication, they found that the likelihood of patient adherence to medical directives decreases when medical provider fails to employ patient-centered or collaborative communication techniques. Likewise, the study found that patient adherence diminished when providers failed to address socio-demographic circumstances and concerns. Schollenthaler specifically pointed to the way in which providers communicate with their patients, noting that providers relied on close-ended and declarative statements rather than communicating with patients about the need for medications or what circumstances might prevent a patient from being able to comply. This points to a difference in culture between medical professionals and their patients. In their book, Communicate, Kathleen Verdebeer, Rudolf Verdebeer, and Deanna Selnow note that culture can be thought of as the taken-for-granted rules for how and why we believe and behave as we do. There's a shared understanding between medical professionals about the best way to handle most healthcare concerns. It can be difficult for professionals to recognize that most of their patients do not share the same values and understanding as their fellow healthcare professionals. Communication between healthcare providers and patients benefits when providers employ intercultural communication competence. Verdebeer, and Selnow point out that some concerns that might need to be addressed to overcome intercultural communication barriers include addressing the anxiety that might exist, being aware of assumed similarities or differences, ethnocentrism, stereotyping, incompatible communication codes, and incompatible norms and values. While this was not written with healthcare professionals in mind, each of these barriers often does exist between healthcare providers and their patients. By using effective communication strategies, medical providers can ease some of the barriers between themselves and their patients. Not all patient interactions are about taking medications or implementing a lifestyle change. Often the communication is to deliver unfortunate news, such as an unfavorable diagnosis or even the death of a family member. In her article, Patient Care in Decline, Susan Barber noted that patient satisfaction has been decreasing. She establishes depersonalization of care as one of the patient's prevailing concerns. Barber points out that the relationship between patients and providers is emotionally charged, as the health, comfort, and sometimes even life of the patient rely on appropriate care. She goes on to say that many patients want the comfort of a caring staff member who will not only provide the best care possible, but will deliver it in a compassionate and respectful manner. As previously mentioned, healthcare settings are often the sites of people at their most vulnerable. In those moments, every bit of communication, verbal and nonverbal alike, carry additional significance to the people caught in the midst of tragedy. Communication training provides healthcare professionals with the tools they need to better navigate difficult conversations. In conclusion, communication training for all healthcare professionals, both as part of their training coursework and as an established component of healthcare facilities, is essential because while not yet a standard requirement for the training of healthcare providers, it is critical in providing the means to effectively communicate with their patients, improving patient compliance and outcomes, while handling difficult moments with sensitivity. In medical situations, there is an increased desire for effective, efficient, respectful, and compassionate communication. Improved communication leads to improved healthcare. Thank you.